Signs of financial trauma. Financial traumas can be caused by large-scale events such as the global pandemic or economic recession, or by smaller occurrences such as unemployment or healthcare costs. It can also be passed down by generations within family systems. Not only can it be influenced by direct financial hardships, but also by racism, marginalization, internalized belief systems, ageism, and sexism. Hi, I'm Joyce Martyr. I'm a licensed psychotherapist with 25 years experience, specializing in the relationship between mental health and financial health. I'm also the author of The Financial Mindset Fix. Let's go over 8 possible signs of financial trauma and some tips for coping with it. Possible signs of financial trauma include: number 1, financial dependency. Financial dependency occurs when a person relies on another person for meeting their financial needs. Examples include children and their parents, the elderly with their caregivers, and stay-at-home partners. Victims of financial trauma may be more susceptible to becoming financially dependent, and victims of financial abuse when they experience chronic financial stress. Number 2, compulsive spending. People with financial trauma may engage in compulsive shopping or overspending, which may lead to a shopping addiction. As humans, we often unconsciously recreate patterns until we become aware and we choose something to change them. So your past money story may be constraining your current financial success in the form of financial self-sabotage through overspending. Number 3, underspending. Financial disorders are similar to eating disorders, and there are obsessions and compulsions with themes of power and control. When people feel out of control due to money trauma, they may become miserly or extremely frugal in an effort to calm their money anxiety. These restrictive behaviors can be harmful, especially not paying for nutritious food or health care that's needed for their overall wellness. Number 4, workaholism. Workaholism is often a response to financial trauma, as a person may work excessively to avoid future financial difficulty or traumas. This can lead to overwork and burnout, which has serious mental and physical health complications. Number 5, financial avoidance. Financial avoidance can involve behaviors such as refusing to talk about finances with other people, financial denial about debt and net worth, and refusing to open bills or look at bank statements. Victims of financial trauma may be financially avoided because they avoid dealing with money because of triggers of fear or overwhelm or worry. So they'd rather stick their heads in the sand. Number 6, lack of financial boundaries. When people have been victims of financial trauma, such as financial abuse in marriage, they may have difficulty setting financial limits and healthy boundaries in their relationships at home and at work. This can lead to some codependent behaviors or causing financial harm to oneself. Number 7, scarcity mindset. A scarcity mindset is rooted in the idea that there's not enough resources, like food or jobs or money, for all of us, so we need to be fearful and competitive with others. This is a normal response to money trauma, and it can cause financial harm. Scarcity thinking can also lead people to keep and hoard objects they perceive as scarce, sometimes resulting in an anxiety disorder or a hoarding disorder. Number 8, excessive risk aversion. It takes money to make money, and when somebody's been financially traumatized, they may be overly cautious about taking necessary financial risks. This may include student loans to better their education, or a business loan to grow their company, or even putting money in the bank due to feelings of mistrust. All of this can impair financial health and be very costly over time. There are various strategies to cope with the effects of financial trauma and learn to overcome it. Doing so is often challenging, so be gentle with yourself as you figure out which of the methods works best for you. Here are 3 tips for coping with financial trauma. Number 1, decrease shame. Due to the shame and stigma associated with trauma and financial struggle, many people suffer in silence. Know that you're not alone and help is available. Number 2, identify your triggers. Knowing what people, places, and things might trigger trigger your money trauma can help you anticipate the minefield and plan your coping strategies accordingly. Number 3, practice self-compassion. Honor your financial traumas and how they may have impacted you emotionally, spiritually, and financially. Stop the self-blame and harsh self-judgment. View past challenges as opportunities for learning, growth, and increased resilience. Here are my final thoughts. Financial trauma is very common, especially during times of economic uncertainty, and it can lead to emotional, social, physical, and financial impacts. Help is available and effective, so reach out for support. Continue learning by reading more on the topic, and be sure to share this valuable information with others who may be struggling with financial PTSD.